Hi, I'm Dr. Nicolai Lennox. I'd like to talk to you about food sensitivities, allergies, how moods and foods relate to each other. You know, it's difficult sometimes to know what changes your mind, changes your mood, changes your attitude. And what I want to tell you is that oftentimes what you eat will determine how you feel. What you breathe will determine how you feel. For example, have you ever noticed sometimes that you have a perfectly good morning, you start out, you're doing great, and then sometime in the middle between lunch and dinner, you just get an attitude from heck. You know, it's like, it's a grind on you a little bit. Things irritate you, people bother you, and it's abnormal. It's abnormal. And so I'm here to tell you that those things can be identified, that those things can be fixed, and you can be sort of back in charge of how that works. There's some things in the environment that you absolutely cannot control. You know, the guy who decides he's spraying for ants every month, or the guy who puts, there's construction next door, or perhaps there's construction at your house, or perhaps you're downwind from a construction site, or there's, any number of chemicals that get in your environment. You react to those things. And if you can learn to identify your reactions, then you can take steps to compensate for it. There's certain foods as well that you may react to. You specifically, and I can help you identify what those things are. And here are some techniques that you can use to sort of begin to get an idea that might be affecting you. Probably the simplest thing to do is tell you a little bit about things that happened to me. Here's a great example. I went out to have some wonderful food the other day, and I just noticed that after I ate that food, my nose started running. And I was, sniffing along, and it was really irritating to everybody around me. And I felt a little bit irritated, the fact that people were irritated about me. And it sort of built into this little cycle. Now, because I know what to do about that, I did know that I felt pretty good before I had the meal. I had the meal, my nose ran, and I was irritable. So I took a substance that we have in the nutritional world that's sort of a natural antihistamine that helps clear that up in the body. And I was sort of restored to normal. I had a chiropractic adjustment in my upper neck because when you're sensitive, that upper neck tends to lock up. And I was restored to normal. And then I did something really stupid. I took some take-home from the same place, and I took it home and stuck it in my fridge. And later on that next day, I decided I'd forgotten about it, so I had some more. Sure enough, there my nose was running again, my neck locked up a little bit, and I was cranky about the silliest little things. And yet I was able to notice that again, and taking the nutritional supplement for that, and then having the upper neck adjusted, I was sort of restored to normal again. And I see this so much in patients. There are many, many people who are dairy sensitive, lactose intolerant, and they know that from lots of family history in that area. Yet they feel they can get away with it because they haven't had a classical allergic reaction. Now, an allergic reaction can be a very dramatic event. And that's not really what I'm talking about. The dramatic events are obvious and easy to diagnose and easy to see. I'm talking about the subtleties. The sort of the chronic neck ache, the chronic pain between the shoulder blades, an ongoing sense of just feeling that people around you are irritating. And I want to tell you, that's not a normal state. There's no explanation for that makes it normal. That if you live or work around people who are irritating, it's not normal to constantly be sucked into that. We become vulnerable by things we eat. So what I want to tell you is this. We can, in a clinical setting with muscle testing, identify foods that you might be sensitive to. I'm finding more and more sensitivity to more and more foods. I think partially that's due to the fact that there's so many pesticides and herbicides in foods. I think it's partially due to the fact that there's some GMOs that are affecting that your body just doesn't recognize them as the same kinds of foods. And I don't want to go on and on about all that. I want to go about the solutions that we have. Because if we can identify something that's an irritant in our body and we can abstain from it and notice improvement, then we can develop a lifestyle that's more supportive of how we want to live. There are lots of people who are sensitive to wheat. I'm not suggesting that everybody should on a wheat-free diet, but if we can identify a wheat sensitivity, then if you experiment and withhold from wheat for a week, for example, just an experiment, it's not a moral mandate, and you notice you feel better, and then you introduce wheat again and you notice you don't feel better, then we have something that you can recognize and make a better job of running your life. Like I said, there are things you can't do anything about. For example, cleaning fluids chemicals in your environment. But there are nutritional supplements that we can use that will help your body get rid of those in a more efficient way with less complications to your body. So what I want you to know is that there are solutions to problems that you don't even know you have. You have to demand a higher standard of your life. If you don't feel well, that's not normal. There's nothing normal about having headaches all the time. There's nothing normal about having neck aches all the time. If we can explain it, that doesn't make it go away. What I want you to do is I want you to be dissatisfied with not feeling well. I want you to demand to feel well and do everything you can to help yourself feel better. And that's my mission in life, is to help you feel better. So I think that if you can take a look at the symptoms that you have, that you find acceptable, move them over to the unacceptable category, come in, find someone like myself to help you out with that. I think your life will improve. And consequently, just imagine what it would be like if you're less irritable all the time. I mean, you imagine what it must be like to be the husband or a wife of someone who's constantly in this state of an allergic or food sensitivity. That means you're sitting across someone who's irritated and irritating all the time. And so these kinds of things, although small, improve your world, improve the world around you, and improve the world of the people you in contact all the time. I know you've all been at the effect of someone who is irritated all the time. Can you imagine how much better your life would have been if they had the kind of care that helped them not be irritable as a result of food sensitivity and environmental sensitivity? I can help you with that, and I think it would be a good idea. Thank you.